Good morning, everyone, and a very warm welcome from the United Nations University International Institute for Global Health, UNU-IIGH. My name is Pascale Allotey, and I'm the director here at UNU-IIGH. I will give a very quick overview of the Institute and a bit of the program and hand over to Rashila. So the United Nations University International Institute for Global Health, UNU-IIGH, was established in Malaysia in 2007 as one of 14 global institutes in the United Nations university system. UNU-IIGH is located at the Medical Centre of UKM, Universiti Kebangsaan Malaysia, the National University of Malaysia in Cheras. The Institute is the designated think tank on global health in the United Nations university system and serves as a policy translation hub in global health for United Nations, member states, agencies, and programs. The Institute supports capacity development of local decision makers and stakeholders to engage effectively with global health challenges within the 2030 Agenda for Sustainable Development, the UN SDGs. UNU-IIGH generates policy-relevant analysis by applying a gender lens to inform the development, implementation, and evaluation of health programs with a focus on specifically on SDG 3, health, and SDG 5, gender equality. Critical to our role is that of a neutral convener, leveraging our position within the United Nations and the network of United Nations university sister institutes, as well as our location in Asia, specifically Malaysia, which we're particularly proud of. The Institute coordinates a variety of activities, including the review and synthesis of evidence around issues critical to the achievement of the Sustainable Development Health Goal, SDG 3. Working in partnership with other UN agencies and academic institutions, UNU-IIGH brings together experts, practitioners, policymakers, and academics, and serves as a platform for critical thinking, exchange of knowledge and tools, policy influence, and consensus building. Advocates for evidence-based policy and the public support needed for change, disseminates and communicates findings and results that are practical, implementable, and understandable, and monitors and reports to the UN agencies on critical policy shifts and trends in global health. UNU-IIGH also hosts fellows in support of its programming and conducts seminars, capacity building, and public events, as well as flagship courses for the region, including on human rights, implementation research, and governance in global health. In 2018, in collaboration with the Resident Coordinator's Office of the United Nations Country Team, the SDG Academic Network in Malaysia was launched to serve a range of functions. To improve engagement of the academic community in supporting the government of Malaysia towards the achievement of the SDGs, to improve the engagement of the academic community with the UN system, the United Nations system in Malaysia, and to support the academic community to engage more proactively in global issues in general and with the United Nations in particular. UNU-IIGH is poised to help to support academic agencies to achieve this. And part of today's function is to ensure that we communicate that message very clearly to you. And to that end, I have the privilege of introducing Professor Dato Rashila Ramli, who is actually a very senior academic within UKM, is the co-chair of the SDG Academic Network, and is a principal visiting fellow of UNU-IIGH. Prof. Rashila, over to you.
Thank you very much, Prof. Pascale. It is indeed a pleasure to be here at the webinar today. And first, I should congratulate UNU-IIGH for its, I believe, 14th anniversary. Am I right? I think so, yeah. 14th anniversary, and for being here within the in cooperation also with the work that we do in UKM. So yes, the network was set up in at the end 2019 at the National Summit and of SDG, and with a group of academicians, we have been working on different fronts. Yeah, it is a very loose network, but we're working different fronts, especially at the national as well, all the way to the local level. So for my presentation, short presentation this morning, I would like to share some of the multiple roles which that have been played by the academicians in many areas, but I will focus more at the national level, whereas my colleague, Prof. Zainal from the Universiti Islam Antarabangsa will focus more at the local level. So we have split up our presentation in such a way, and hopefully that will profile a bit more of the work done by the SDG Academic Network here. So let me share with you my screen. Okay. Yes. So I would like to discuss a bit on the multiple roles of academics, contribution to the Voluntary National Review 2021 process. This was one of our major works at the national level this year. And three major points that I would like to highlight in my presentation are multiple roles of academics to champion SDGs, contribution of the Voluntary National Review 2021 process, contribution by the academicians actually, and other platforms for contributions as well. All right. Let's see next. Okay. As we all know, SDG is a global framework, a global, I would say, development framework that was put in place from 2016, and it will go on right up to 2030. Where Malaysia is concerned, it has been aligned. Yeah, SDG has been aligned to the 11th Malaysia Plan, and definitely it is under alignment also with the 12th Malaysia Plan, which should be tabled anytime now. So within the 11th Malaysia Plan, which was already in place for 2015, so this was the first part of the alignment. And then when we did the midterm, the country did the midterm review, it was put within a few pillars right there, 5 different pillars. Yeah, so different SDGs are being aligned to the different pillars in line with the 11th Malaysia Plan. So this gives us a way of understanding how SDGs are being fit at the national level. Now, from that, in terms of the structure itself, structure of, I would say, governance pretty much, while there is the National SDG Council right here, chaired by the Prime Minister, the Secretariat is very much with the EPU. EPU is our Economic Planning Unit. And under that, there is the Steering Committee with 5 working committee on the different trusts. All right. So and from there, a roadmap of SDG was worked out by the Steering Committee. And I believe if you like to access the SDG roadmap, it is available on the EPU website. So please go ahead and check that out. Yeah. Okay. Yeah, spaces of engagement by academicians are basically in different areas, definitely through our public university, private university, and we have different networks, but the network that we are focusing here, hosted graciously through UNU-IIGH, is the Malaysian SDG Academic Network. We also work within within CSOs, yeah, the civil society organizations. Here you have the Malaysian SDG CSO Alliance, which have many members who are academicians. And then there is the Malaysian Social Science Association, which is recognized as the regional association. It is the national association, but recognized at the regional level of the Asian social science research councils. In the public realm, we have colleagues, we have academicians working within the APPGM. APPGM is the All-Party Parliamentary Group Malaysia. It is a bipartisan organization within the Parliament Malaysia, and that was established in 2019. And that organization have been carrying out SDG work since 2020. Okay, and in the second presentation later you hear more about it. So roles of academicians, generally we tend to do research, and teaching, and from that we also do quite a bit of policy input. But there are two other roles which we must also recognize, which academicians can really do, which is advocacy as well as to be solution providers for problems or issues that we have identified at the ground level. So SDGs, through SDGs, this is one way that you can actually work to do some advocacy work as well as to provide solutions as well as capacity building. Yeah? So these are some of the roles that you can look into. Now, at the national level, the Voluntary National Review of SDGs, the review of SDGs is a mechanism where our government actually make voluntary report to the United Nations to show the progress that we have done. Actually, so the first, it is a voluntary process for the government to report of the process challenges in implementing SDGs. Now, Malaysia did submit its first VNR in 2017 as part of the country's commitment to the SDG process. And for 2021, another 9 SDGs were covered. 1, 2, 3, 8, 10, 12, 13, 16, and 17. EPU, as the lead agency, started the process in February, and it was completed in May 2021. The initial consultants, the consultants were actually from UKM, ISIS, as well as Talent Center, and consultations were done with many sectors, including the academic network, the SDG Academic Network. Okay, so when the complete report was done, it actually, hold on a second there, it covers a total of 7 chapters. So I'm just showing you the chapters. These are also accessible. So I believe it's on the EPU. If not through APPGM, I think you can also get a copy. So here are the 4 chapters first, and then quickly another 5, 6, another 3 chapters here. Okay, so it covers all those 9 SDGs which were under review. 5, 6, 7, correct. And where the SDG Academic Network is concerned, we did have a consultation session on February 12, 2021. So there was an online session. So I pulled this photo out from my iPhone, and we had it for about, I believe, a couple of hours, where we had the consultant, I think Dr. Alizan right there, who gave us a short presentation as to the flow, what is expected. So from there, different organizations, including ours, submitted our written report to the consultants who wrote the report out, but then it was given through the EPU, which actually had the final say. From there, for us specifically through the SDG Academic Network, we actually focus on SDG on education, SDG 8, which is on decent work, because these two are quite cross-cutting. The training of graduates, undergraduate students, yeah, and how it is matching up with the job that they are getting for the future, or they are going to move, not so much for even now. I mean, these are issues that we brought up. So we do have we brought up issues such as 70,000 youth with mismatch between skills and industries. So there is a need to prepare the youth for the future of work, training and reskilling of both the youth as well as even retired workers, because there are a whole group of retirees whose expertise cannot be bought. Yeah? So these are the kind of things we look into. Definitely, in terms of number 8, low-income female-headed households are exceptionally vulnerable, with higher rate of unemployment at 32%, and of course, with the pandemic, inadequate social protection. So all this comes up with different suggestions. And then we also made further submission on gender as a cross-cutting issue. Women's participation in labor forces is only at about 55%, which is lower than other neighboring countries within ASEAN. And the global average is about 63%. Once again, we talked about the graduates from higher education institutes who are women, and this group are not represented in the employment sector. So what do you need to do? Foregrounding the youth foreign workers, highlighting reports on under the present condition, gender-based violence, harnessing digital economy for women's empowerment. So looking this as a cross-cutting issue, yeah. Then there is also the language of the subject matter, which needs to be put in place. And we see that coming through the use of appropriate languages to discuss subject matter. And in SDG 17, the implementation of data collection and reporting system that needs to be, the data collected needs to be that disaggregated data, and the promotion of a whole of society approach as well. So these are some of our contributions in submission that we did, and it was taken up. Specific for health, there are a number of things that came up under SDG 3 status and progress. I'm not going to be reading all of this, but definitely there is a need for there's an urgent increased investment in Malaysia's healthcare infrastructure. So this was brought up highly during the discussion on the status and progress. This was actually part of the report given that was shared by the consulting group at that point. Yeah. So issues and challenges, once again, there are quite a number right there. But maybe what we need to look into is the fact that since the first reported case of SARS infection in the late 2020, we know definitely there are many more waves, and we are still fighting it at this point. Yeah, the present figure is, what was it, a couple of days ago, 22,000 cases. So we really need to be vigilant, and the fact that COVID is here, it is becoming endemic, and we need to live with it and do the best that we can. I think my time is running up a bit, but anyway, opportunities and way forward. Okay, these are some of the things that we was highlighted in the report. Okay, so this was the report that was prepared, and it was given to EPU. Some of this came from our network, but most, it was a comprehensive exercise from the academicians, from NGOs, from private sector, and other institutions. So that is important for us to keep in mind. Then on July 15, the whole week, I think the second week of July basically was actually on the high-level political forum under the UN system, where the VNR was presented, and Dato Sri Mustafa presented it on Malaysia's behalf on the 15th July. There were a number of panels, and I was honored to be asked to moderate one of the sessions, which is on civil society's perspective in the implementations and commitment on multi-stakeholders. Okay, so that was in July. Quickly, yeah, there are many other platforms for academicians to contribute to SDGs. We are actually, we under the network, we also train a group of evaluators for impact assessment on SDGs. So that was done in January. And this we have about 18 evaluators right there from about 13 different universities. Yeah. And later on, there were other conferences and webinars that were held. The most recent was held last week, 2 weeks ago, 17th of August. And at that particular program, we have Professor Dr. Adibah from Universiti Malaysia, who delivered a keynote specifically on COVID. And then we also have a panel in cooperation with partners in Frankfurt. So this work that was done earlier. These are some info given by that. This is given by Dato Prof. Dato Adibah. Yeah, why our public health data systems could not handle COVID very well. You know, they've been neglected, underfunded. There are many things which need to be looked into. 6 priorities for immediate action from Dato Adibah. Yeah, mitigate data, ramp up, find, test, trace, isolate, and support. Step up intersectional collaboration. He also mentioned definitely there is a need to ramp up vaccine demands, strengthen operations, and decentralize decisions and action. So I think with that, I'm going to finish my presentation. So thank you very much. And I think we'll move on to the next presentation. Thank you. Let me unshare, stop my slides. Okay, thank you.
Great. Thank you very much, Rashila. For those online, if you have any questions, please, can you begin to put them into the Q&A function of the Zoom chat while we prepare, Nadia, the next presentation, which is by Prof. Zainal bin Sanusi, who is the director of the Sejahtera Centre for Sustainability and Humanity at the International Islamic University of Malaysia, who will talk about, again, about with a focus on the SDGs and how as academics we can engage better in this critical agenda that is about sustainable development into the future. Nadia? Prof. Zainal is not able to join us live, but he very kindly recorded his presentation. Sorry, Nadia, please go ahead.
Very good morning. Yeah, for those of listening. Yeah, I'll be presenting today, sharing the experience of. All right, I'll be sharing the experience of localizing SDGs and trying to look at the role of university researchers based on the 1.5 years experience of all-party parliamentary group on SDGs activities. I'll be looking at 4 topics, four components as to how to establish that, how important is the role of researchers. One is to look at researchers as community members. The other one is researchers as solution providers. And then also be sharing researchers as a trainer for capacity building, trying to localize SDG. And the last one, researchers as a policy educator. What is the context? What is the background? Is that this is how I see the role of university researchers coming to the ground and trying to localize SDGs. We know that when we talk about Corporal Helix, they've got the actors of industrial business activities, and then you've got the policymakers, you've got the NGOs, and then the 4th one will be universities. But in this context, what I would like to highlight is that how within the universities, the existence of research researchers playing that role. Yeah? And for the context of like trying to expand it and trying to go deeper, what I'm trying to suggest here is that multiple pillars, 5 pillars of it, try to break up the NGOs and the community members. So this is how the kind of like setups context that I'll be referring to. And we know very well that in universities, the main mantra functions are teaching, research, and community engagement. Though some people may see community engagement as quite secondary role, but in the case of SDG, in the case of this topic, I would like to highlight that community engagement should be an equally important component of the functions of the academicians in that university. And then we know that the academician is a thought leader, meaning that not only for ivory tower context, but also for the society. And then we also know that academicians are researchers that are supposed to be creating impact to the society, not just to write in impact factor journal. In another word, what we talk about is that to do and get engaged in translational research. And the last one is to link theory to practice. And the most important one, or one of the most important ones, to translate that research to policy advocacy. So let me pick up on the first one, researchers as community. So when we started this journey, we never know what is to be expected on the ground, because some researchers are quite used to a very lab kind of environment or a very set up environment. But when we start to go down to community, there's a lot of unexpected or something that we never experienced before. But alhamdulillah, I think when we start slowly going down and put ourselves as a community member, not as university people talking about theories and etc. So when we go down and behaving ourselves as one of them, then we get to realize that we have an equal role with them as a community members. So we put our hats of researchers off in this context, but we still do have that in mind, But in the context of how we play this role, we see that close interactions and open discussions and open mind as community members with researchers framework help us in terms of understanding what is the main concern by the community members. So in this context, what I'm trying to highlight is that if you go down, and when we go down as a community members, it makes a lot of difference when we go down as a researcher. So that's why in the context of localizing SDG, we do have that framework of researcher, but the challenge then will then to somehow get into the detail of how putting ourselves as another community members. So that's one component of how researchers should be transforming themselves when they want to localize SDG. And then the second component of researchers in terms of localizing SDG is that we ourselves is functioning as solution providers. What do we mean by this is that usually a researcher will come down and get data, do profiling, community profiling, etc. and go off. And then come back again just to get further data. But then in this context, the researcher, as a researcher, when we go down, after functioning as one of the community member, then try to get to understand what is the problems, and then what we're trying to do is that to provide solution for that. So we are not seen as just one-off people coming up as a researcher. So that kind of like introductions and projections of us as a solution provider is very important to create and establish that rapport. So in that context, many of us are part of the solution provider together with NGO, together with the villagers, together with the orang kampung. So that's how we see ourselves as a researcher, but at the same time we are trying to provide actions-oriented solutions to the SDG problem in that particular area. The third role of this researcher, us, when we go down and then find the solutions, having understood the community profiling. So we then try to get into building up the capacity of these villagers, the people in that constituency, to be empowered and sustain their activities and expand the solution that we provided working together with them. Yeah. So in that context, as a trainer, the researcher has strong advantages, yeah, in a way that we start from very beginning, yeah, profiling of the community, and then we know what is the possible solutions, and based on these two, then we enter into the third role of researchers as to do the capacity building to ensure that when we want to really localize the understanding, localize the implementation of SDG at that particular area, constituencies or district or that village, we can connect what kind of information that they've gathered before. So meaning that we can really contextualize our training with them. So that make them feel comfortable because we are talking about actual issues that they're facing surrounding them, rather than talking something from the textbook, talking from something that we get from outside. Yeah. So that's the third role. And we've done this, I think, at least in 25 constituencies. And we gather that it's very important as a researcher, you don't stop just at the research. Yeah, you get into the solutions, then you get to work together with them so that they can be empowered, they can be even more educated in order to really understand and then solve the problem of sustainable development in their particular area. Yeah. When we go down, it's not only researchers. Yeah, we do bring in the solution provided from the NGO's perspective. Yeah, and then we also bring in the perspective of the policymakers. So these are the people that we met. Yeah? And remember when I talk about multiple helix, so as much as possible, when we do the capacity building, these are the perspective that we brought in, because we don't want the capacity building program to be something that seen as an academic exercise. Yeah? So that's why always, as much as possible, the 4 perspectives, if not 5 perspectives, is always being brought together. So we really want to establish the fact that the training is not something that coming from vacuum. Yeah, it's something that we developed from very beginning based on data and informations and issues and challenges that we have gathered from the research exercise before. And the fourth one, yeah, it's an outcome, it's a final outcome of what we do as a researcher in order to really impactfully localize the understanding of SDG, implementation of SDG at the local level. We know that after collecting all the informations, issues, and challenge, we found that one of the major problems is that they can be a very interesting, very nice, carefully, thoughtfully drafted policy from a federal level or from state level. But when it reaches at the ground level, that's where the issues of policy implementations or policy deliveries. The good one, of course, we would advocate for the good policy, the efficient policy. But since our mission is to deliver the best mechanisms in implementing SDG. So what we do is we try to see it from the perspective, from the bigger perspective of policy framework. So what we found there is that the issues, for example, issues of education. So we found that when we talk to ABD, district education district officer, they get the policy, they get the incentive, etc. from the federal level. But the challenge is that these policies are designed for a very bigger perspective, yeah, to the whole nations. But usually what happens is that the contextual challenge of implementing that policy sometimes is not captured. So as a researcher, this is something that we should be able, and alhamdulillah, so far we managed to somehow link, yeah, either to strengthen the delivery by linking it back what should be there, or in terms of like trying to improve, is that we put all these challenge or all the issues that we found, that we gathered, and talk to the relevant agencies who are supposed to be implementing their policies, and then from there we try to somehow pull out what else can be improved. So in terms of our project as a researcher, yeah, once we complete this cycle of from the role number 1 until this role of policy educators, as wrapping up of this exercise, this is where we on our own you prepare a report on implications of the policy challenge, and then submit it to the parliament, yeah, for their further discussions. So what I'm trying to share here and conclude from this sharing of how we can localize SDG by optimizing the role of researchers via the 4 function is that unless and until that researchers are willing to somehow play the 4 roles and be serious about talking to all the 4 stakeholders, the other 4 stakeholders, the government, the NGOs, the community, and among the researchers themselves. So as a conclusion, what I would like to conclude is that in addressing these SDG issues, universities plays an important role, but usually all this while the function of the CEC is seen as just to provide research solutions and also do teaching and learning. We don't see the community engagement role of the researchers. So here, what I would like to present and convince from this case is that the researcher, while they function as a lecturer in teaching and learning, while they function as a researcher in doing research and development, they must bring in all these 2 aspects, into the functions of engaging with the community, not just to engage as a service delivery or helping the community to get this and that, but to empower them. And how do we empower them is by through the 4 function. So hopefully with that, I hope that I have shared something hopefully will be useful in these discussions for a bigger implication of how we can change the role of universities in localizing SDG. Thank you very much.
Thank you very much, Prof. Zainal, for that really illuminating presentation and really thought-provoking presentation as well. I noticed that we've got a few questions coming in with not a whole lot of time. Unfortunately, Prof. Zainal isn't able to join us. The first one, if I can put it to you, Dato Rashila, I do have some thoughts, but I think I'd probably hand it over to you first, is how can we encourage more students in Malaysia to go deeper into their curiosity and become researchers in areas that matter, but more, in global health and sustainable development? A question from Mohammed Jafar. Would you like to have a stab at that?
Yeah, thank you so much, Pascale, and also to, of course, Mohammed Jafar for putting up the question. With students, I think what is important is that they usually do have some kind of a project-based program that they need to put out, or if later on they may have a short thesis. Whatever it is, the main thing is to encourage them to work on a project which is close to their heart. It's not something that, something which is just based on secondary reading. Secondary reading is fine, but if they can be linked up to community engagement work, even in the area that they're staying in, these are the kind of issues which can actually be much more meaningful. Now, secondly, with the senior scholars, there has to be a good mentoring system as well. Sometimes you just can't let the student go out just immediately, but there's got to be a training and guidance along the way. So I would say, number one, students need to be put to issues which are close to their heart. Number two, when they are mixing with the communities, this is where they get the sense of empowerment, the sense of ownership of the project. Then this is the way that they will actually relate better and getting better results for the future. And the senior lecturers should also be mentoring them in the process. So this is a very quick answer to us. To actually, you need much more elaboration. But anyway, that would be my take at this point.
Thank you. I think I had some similar points, but I do want to add one other thing, which is that I think structurally, very often our universities have the wrong, say one thing, but provide the wrong incentives for this. Because if we look at the sorts of incentives and what are the kind of research that is valued, or the research for which funding is available, it doesn't necessarily tend to address some of these critical issues that are actually the real, that provide answers for real challenges for working with community and so on. There's so much more money available for the high-tech end of things and for the technologies than there is to really trying to answer some of the basic fundamental questions that are of real importance to people in the communities and people for whom the SDGs really need to work for. So I do think that there is as academics, we have a role as well in pushing back against the systems. If these are the things that are valued, then we need to make sure that the systems that are available really support these sorts of questions. We have another question, which is, how far behind do you feel Malaysia's health system and related policies have fallen due to the COVID crisis? And what can be done to recover precious gains lost in the next years? From Aina Asma. I will take a very quick stab at this. We don't have many problems, but to say that from a global health perspective, this is not a problem. This is not an issue solely for Malaysia. That the COVID crisis has been unprecedented, and I don't think any country has demonstrated really well that it has got all the answers for it. And I think I would throw the question back to you in terms of your engagement with the kinds of questions by doing some global analytical work as well, to look at countries that are similar to Malaysia or countries that you think have a better system, and be a part of the solution in trying to do some of the analytical work as well that will help to support the efforts of the health system, and use as Prof. Zainal had said, that we need to, and I think Rashila had mentioned as well, that we need to engage better as advocates. And we can do that particularly powerfully with the use of data that is available, with the use of comparison at a global level to see how we can share and bring together lessons from other places, or how we can take lessons from here in Malaysia to other places to be able to answer what is a really, really tricky situation for all of our health systems everywhere. It's not just Malaysia, believe me, it is a global problem that we really do need to spend less time being criticizing, as is often the case with academics, and actually find ways of positively engaging with finding the solutions. I see our 45 minutes is up. I do want to, and I know that there are a few other questions. We will see how we can respond to these and share them. The YouTube link will be available. We will also send information out on this. There'll be a report on this on the UNU-IIGH website shortly after this. But just to say to everybody, a really big thank you. I think what the engaging with the this academic network does is actually provide improved rigor for reporting for the government, of being able to use evidence to hold the government accountable where we can. And it provides a great opportunity for academics to enhance the policy relevance of their work, and be able to identify some of the new priorities and innovations that the government needs to know in order to enhance the well-being of their citizens. And I'll hand over to Rashila, please, to say some final words before we close.
Yeah, thank you very much, Pascale. Yeah, this time is really too short. There are a lot more questions right there. I just pick up one quick one, because under the current political situation, will it affect the important community engagement? I'd like just to address that real quick, because in the both presentations, myself as well as Dr. Zainal, the fact that we have worked bipartisan, crossing different party lines and so on within the parliament, that has actually allowed us not to worry too much about the political situation, but the common goal of ensuring that SDG is being implemented at the local level. It's got to be localized, so it can be done. So as a closing, thank you so much to UNU-IIGH for having, hosting this particular webinar, and for our partnership for the academics. As I mentioned earlier, there are multiple roles that we can play. We can definitely localize SDGs for Malaysians in our different communities, and I hope that we can see this grow in the future. And with that, I do thank you, Pascale.
Thank you, everyone. Have a lovely day. Thanks.